Hi, this is Dr. Walker. Welcome back to the channel, denwalker.com. Today we're talk a little about what happened to me recently with my lab work. So I had to get my normal routine physical stuff done, and they did my blood work and so forth, which was great. And I was super happy to see my results. And typically what they'll do is they'll have you come in and see the provider anyway, just to kind of talk about stuff. And I don't know if she knows me or what I do and so forth. I don't tell people normally that I'm a physician. I don't tell them that. I just listen to what they have to say and sort of go from there. So I really thought she was going to look at me in my mid-50s and kind of go, "Oh my God, your lab work looks really good. This and this." She didn't do that. She did not do that. So I'm sitting on the table waiting for her to tell me, how good my results are and whatever else. And she goes, "Well, your triglycerides, your total cholesterol is a little high, and so you could do well with a statin." And I paused for a long time. I paused, and it seemed like forever. And so I said to her, "Why? How would that help me?" She goes, "Well, it could bring your LDL down and maybe increase your HDL a little bit." My HDL was almost 90, and my triglycerides I think was 89. So my triglycerides to HDL ratio was 1, which is the reason I was kind of super happy with that, because it's a really good indicator of my risk for significant coronary disease, which she did not even realize. And so we started talking about that. And I said, some stuff I read recently, this and this, that if your triglyceride to HDL ratio was really, for me, less than 1.5, super good for a white male. Typically 2 to 2.5 to 1 is also super good. But I'm 1 to 1. And I thought to myself, why would you even consider putting me on a statin? So we had a little discussion about that. And she goes, "Well, yes, you're kind of right about this and this." And, but just, I then imagine how many people goes into her office that have a similar profile, or even a 1.5 or even 2 to 1. And the discussion then becomes, how do you then, quote, lower your cholesterol, whatever that means, by giving me a statin. Now, I was going to begin asking her or talking to her about some of the common complications of statin usage, and I thought, you know what, let me just not. So I said to her, "Well, I think my numbers are fine. I think my total cholesterol is high, but many people don't have a HDL of 89 or thereabouts, and the triglycerides. The ratio that I had, not many people would have that. And if you do, great for you, but this and this. But it's not a very common thing to see, and I was very happy with my number. Could it have been better? Absolutely. Do I need a statin for that to lower my, quote, cholesterol? I do not think so." So I left her office, and I think we were not in bad terms, but I think we're in decent terms, because I told her essentially that in order for me to even consider that, and I would never consider it, I'd have to look at the fractionated part of my LDL for her to tell me that it is the bad part of the, quote, LDL, like my small dense particles. That's the bad part. If that was high, then I would do some things to consider decreasing my LDL from that standpoint, to make it more, quote, reasonable. That's what I would do. But she never mentioned anything about sort of dietary things that I could do to make my, quote, cholesterol profile any better. And again, I get it. There isn't a whole lot of time per se that she has to discuss this. But I just want to let you know. Actually, those two things. One, when you look at your cholesterol, I would, because many of them do not look at your fractionated LDL cholesterol, look at really your triglyceride HDL ratio and see what that looks like, right? Now, and you can ask them, what is the goal ratio there for you, right? And it should be kind of where we're talking about there. And have them sort of have that discussion with you, and then have them show you then the additional risks benefit that you would get from getting an additional from a statin. Just get that sort of discussion from them. And obviously, if you're going to use a statin, great, it's on use. Now, I'm not telling you never to take a statin, but have that discussion with them to say, what is the risk reduction I would have if I added a statin to my profile already, which again, my triglyceride to HDL ratio was 1. What is the additional benefit for that? Now, so here are some problems that I've known about with statins for a long time, and one of the reasons I would never add one to my diet. Now, years ago when I did general medicine, when you added a statin to someone's profile, you did liver enzymes essentially a couple of 2 or 3 months down the road to see what happens with their enzyme function of their liver, because there's always an association of inflammation from starting a statin. And sometimes it was so bad that you'd have to stop the whole thing and see what happens, and to be certain that the person's lipid panel came back to sort of normalize, or sort of change them to something else. That's way back in the day, 20 plus years ago. I don't know if they're actually still doing that now, but there was could be significant inflammation, almost like a hepatitis sort of picture, from being on statin. The other thing that happens with statin is you run the risk of pancreatitis is the other one. And if you've not seen someone with pancreatitis, you don't want to see that, right? It's an intense pain, and many of them, some of them will actually end up in an ICU because the inflammation is so bad and the pain is so bad. Muscle aches and pain is sort of the other one that people get, because there's a whole coenzyme Q, which sort of energizes a lot of the cells of the body, that gets chopped off from starting a statin. And in fact, some people, the pain is so intense that some doctors actually tell them that it's actually in their heads, right? And it will do nothing about it. But some doctors are reasonable and will try to change it to a lower dose, or try to change it to something else for you, just to see what would happen for you. Then the other one you run the risk of is diabetes. And here's the part I don't like about this. So your blood sugars begin to elevate. And for most people whose blood sugar is super, super normal, great. But if you're on that verge where you're sort of pre-diabetic, or in that zone, if you would, and you're starting a statin, you run the risk of it pushing you over that edge. Now you become labeled as a type 2 diabetic, right? Now, I'm not in that. I'm not a part of that, because then what they're going to then do is then give you another pill, right, on top of the pill that you're already taking, to, quote, mask the symptoms, or mask, quote, protecting you from type 2 diabetes in terms of blood sugars and so forth. They'll add something else, another pill, right, as opposed to giving you a discussion about diet and exercise and those kind of things. They don't do that. They typically will then add another pill, Metformin or whatever it is, to try and, quote, treat your newly diagnosed type 2 diabetes. And again, all for what? All for what? Because some person think that you're looking at just your numbers alone will say that you are now a person that would benefit from a statin. And really, I won't go there, but that's what they'll tell you. You get lots of gas also, abdominal bloating. People report insomnia as well. And then the other big one that some people report is they lose their minds. Literally, they begin to have like memory losses and sort of forgetfulness. And people have been, quote, labeled as early onset Alzheimer's because of this, right? So people are now, quote, having that label of Alzheimer's, all because they're on it could be, not that it is always, but it could be. The people have been reported that they were on a statin, then they stopped their statin, and their memory essentially came back. That label of Alzheimer's essentially got removed from their whole list of things. So just be careful when someone says to you, hey, oh, by the way, your profile now requires that you get added on a statin. And because all of these things, and some people, if you have known coronary artery disease, there's a questionable little increased risk reduction from that. But for the most part, if you're not, sitting there, eating cookies, pies, cakes all the time, and triglycerides, 500 and HDL is 20, right? I'm not certain that benefits you a whole lot, right? My suggestion to most people would be to drop your triglycerides as best as you can. And when you do that, when you drop your triglycerides, you'll notice that your HDL may come up a little bit. You will likely lose some weight. You'll feel a little better, right? So the cookies, the pies, the ice cream, the sort of the fast foods, right? All of those things, the frozen pizzas, for example, those things need to go. And then sort of one of the big ones that really need to go is really the amount of times or days that you are drinking, quote, fruit juices. There's no fruit in your fruit juices, like it's all sugar. High fructose corn syrup specifically. Sodas, right? All of those things. So sodas, shakes, milkshakes, fruit juices, all those things need to go. And again, the more you reduce those things, the more you'll see your triglyceride levels drop. Your HDL may raise a little bit as well. You'll feel better. You'll lose a little weight. And your LDL will drop a little bit as well, right? That's what I would suspect for most people. If you give them sort of the option of, hey, listen, you need to modify your current diet, you know, get a little walking in there, drink some more water. Maybe, you know, instead of sitting for a half hour having your lunch, maybe you have your lunch and then go for a 15-minute walk, that sort of stuff. Just do things as best as you can to decrease that triglyceride level, and you'll lose some weight. You'll increase your HDL, right, and that may keep you off of that that label of being on a statin. Once you're on a statin, once they put you on a statin, the chance of you getting off that statin is little to none. Little to none. And I hate to tell people that. I hate to tell people, you know, that bit of information. But that's what happens. Once you're on that statin, you're on there forever. And so you may end up having this low muscle ache and pain and those kind of things. And you forget what you felt like before, 5 years ago, 4 years ago, when you didn't have this low level inflammation. You didn't have this fatigue. That's the other one that statins can do for you. You forget how halfway decent you felt 4 or 5 years ago, and then you added the statin, and then you feel this kind of crummy way of can't sleep and you can't think and you can't focus and you're lacking of energy and sort of this low level muscle ache and pain. You forgot that all of those things really started when you started the statin, and the chance of you getting off the statin once they push you on it, again, slim to none. Take care of yourself, Dr. Walker.